Go.
Hi, my name is Shatwayla. Today I'm going to be performing a head to toe physical assessment. I've already performed hand hygiene. I provided the patient with privacy. I have asked the patient their name, their date of birth, and their location. The patient answered, responded accordingly. His speech was clear. He was alert and oriented times three, and his facial expressions were okay. I'm going to start by assessing the patient's head, looking for any discoloration, the distribution of hair, the symmetry, any lesions, and then I'm going to move down to the patient's eyes. I'm checking for the alignment, the symmetry, the color, and edema. Everything looks okay. There are no assistive devices. I'm moving on to the patient's ears. I'm checking for the shape. I'm checking for the color. I'm checking for the symmetry, any lesions. Everything looks okay. There are no assistive devices. Moving on to the patient's nose. There's no congestion, no drainage. I'm checking for the symmetry as well as any lesions. Everything looks okay. I'm checking the patient's mouth, the lips, oral mucosa, hard and soft palate. Everything looks okay. No gingivae. There are no dentures. The patient's teeth appear to be okay. I move on to check the patient's carotid artery. I check both of them individually. They feel okay. I move on to assess the patient's chest. I'm looking at their breathing. The breathing appears to be fine. I'm going to listen to his lungs. Six in the front. Ten in the back. Everything sounds fine. I'm going to check the patient's apical pulse. It's located along the mid-clavicular line, below the breast nipple, between the fifth intercostal rib. I'm checking here. Then I'm going to move on to assess the patient's arms. I'm checking the brachial pulse, both arms. I'm checking the radial pulse, both arms. I'm checking the temperature. Everything feels okay. The patient squeezes my hands. He has good grip, both hands. Checking the capillary refill. The refill is prompt. Then I'm going to assess the patient's abdomen. I'm going to look at the abdomen, check the shape, the contour, everything appears fine. I'm going to listen to the patient's abdomen in the four quadrants. And then I'm going to feel. And everything feels fine. I'm also asking the patient when was the last bowel movement, I'm asking about diarrhea and constipation. I'm also asking, has the patient had a cough, sneeze, any shortness of breath, any difficulty breathing with activity, and everything is okay. I am checking the femoral pulse on both sides. I'm moving on to the leg. I'm assessing the leg for any blood clots, any discoloration of the legs. Everything looked fine. I performed the Holman sign. Everything is fine. I am checking the posterior tibia, and I'm checking the dorsalis pedis on both legs. I'm checking capillary refill in the toes. I'm checking for discoloration, any lesions. I have the patient to press down on my hand and push back on the patient's foot. I am checking the popliteal pulse. There is no NG tube, no oxygen, no IV lines, no catheters. Everything appears to be fine on the patient. I ask the patient if they have any immediate needs. I make sure the call button is within reach. I make sure the bedtime table is nearby, the bed is in the lowest position and locked. I perform hand hygiene, and my skill is complete.